And in the studio with us this morning, our Indiana Regional Medical Center IRMC Physician Group visit is with Dr. Timothy Wong. Good to have you back with us. Good morning.
Good morning.
And you brought with you Kyle McCormick. Kyle, good morning to you.
Good morning as well.
Kyle is a pharmacist, yes?
Correct, yes.
At Gaddy Pharmacy.
Yes. Yeah.
All righty. All right. And Dr. Wong, we're talking about medical therapy management. All right. What is that?
So medical therapy management is initially a program created by Medicare. It's for seniors or those who are on the Medicare program. So it doesn't apply to those who have commercial insurance or on Medicaid.
Mm-hmm.
But those with Medicare, and especially Highmark, we're actually partnering with a local pharmacy, Gaddy's Pharmacy, to provide a better medical therapy management program for our patients. So medical therapy management, I'll let Kyle kind of go into the details, but is designed to help make sure patients are taking the right medications. And really, in the past, it was kind of done on the telephone.
Mm-hmm.
And we try to do that in person. So it has a personal touch, a local flair, but also improves care.
Okay. All right, Kyle, your turn.
Sure. Yeah. So a little bit more about what medical therapy management is it's a comprehensive review of a patient's medications. So what we do is we sit down with the patient, we go through each of their medications. That includes prescription products, herbal supplements, over-the-counters. We look for any concerns for safety or effectiveness, and also any ways to save the patient money. So a lot of times, whether it's at the pharmacy or at the doctor's office, we're not getting that comprehensive look at the patient's medication, whether it's over-the-counter product that's being missed that might interact with one of their prescription products,
Mm-hmm.
or maybe it's a cost issue that a patient doesn't feel like is appropriate to discuss at one of those appointments, or thinks that that's the only medication they can be on whenever there are cheaper alternatives or cheaper ways to get that medication.
Mm-hmm.
So we look through all of those concerns and we identify what we call drug therapy problems. We share those with the patient and we troubleshoot those and come up with solutions, and then we also communicate that back to the doctors. So it's a program we've been doing, as Dr. Wong explained, it's a Medicare benefit, so we do it for Medicare beneficiaries. We've been doing it for years, but with this local partnership here, we have been working with the Highmark patients and specifically in Indiana Physician Group. And so those encounters, the results of those encounters are being sent directly back to the patient's local provider.
Mm-hmm.
It's a lot more personalized experience and hopefully a greater benefit to those patients.
In today's world, it seems rather inconceivable with all of the communications and technological capabilities that there are out there, that this is still an issue of making sure that everybody's on the same page, which is basically what we're talking about, isn't it?
I think it's even more than just if we're on the same page, because I think what happens is this is a double check. It's almost a free visit for patients who qualify to see a health professional, which would be Kyle, so that he can go over their med list and make sure that, the meds are safe,
Mm-hmm.
but also affordable, and if there's any problems.
Mm-hmm.
So I think, the best way to think about it is pretty much a free visit just to make sure things are okay.
Yeah. And from the IRMC Physician Group standpoint, with so many different physicians in so many different disciplines, what a tremendous advantage that is to have that sort of a not just accountability, but that sort of professional that is going to stand there and be able to provide valuable input.
Yeah, I think actually we're the only organization with, I think in the region that's partnered with a local pharmacy to provide this service to our patients.
Mm-hmm.
Most of this is kind of outsourced to a company, and they do this over the phone. And I think, having a local flair, having a local pharmacy help out, and having Kyle meet with patients face-to-face is kind of the ideal model.
Mm-hmm. Kyle,
Yeah.
tell me how this works out from the actual putting it into practice from your standpoint.
Sure, yeah. So what we do is we call the patient who's been identified. There's different criteria for patients that are eligible. So it's the amount of medications they're on, the disease states that they have, number of disease states. And those patients that are eligible, we then call and try to schedule an appointment. Like Dr. Wong said, it works best whenever it's in person. So we really try to get that in person. They can bring in their medications, what we call a brown bag. So we go through each of their medications. We've identified patients where they just have bottles of duplicate medications that they've been taking.
Mm-hmm.
So it's a good opportunity to kind of look at everything they have at home and consolidate that into an actual list of what they should be taking, and then removing things that they shouldn't be taking. So that is the ideal in-person visit, where we go through each of those medications, communicate that back to both them and then the provider. If it's by phone, we call them. If they prefer to do it over the phone, we can do that. And it's the same kind of setup where we just go through each of their medications and identify drug therapy problems.
I think it's a really fascinating way to work this out, because I would guess that there are people taking medications who are patients of several different doctors for several different problems, and you're able to see with what they are taking from Dr. A, how that might or might not work with the medications that are from patient B. The results could be quite negative and quite harmful to them.
Yes, definitely. And even with the improvement in terms of communication and electronic health records, we are moving towards a better system where we have a concrete list whenever you move from provider to provider of what a person is taking, but that can be changed by patients not communicating those changes to their doctor, or a doctor not updating a note, or even a pharmacy not sharing with the doctors some herbals or over-the-counters or different things that the patient may be purchasing at their pharmacy, especially with a lot of things moving over the counter now. That's important that's traced back to that patient and communicated appropriately. So it is a nice review of everything.
Yeah, Dr. Wong, he mentioned herbals and other over-the-counters that people take. Whether you see them on TV or you pick them up somehow online and you figure, okay, this is what I'm feeling. Maybe this is going to help me, and I should start taking that. So without a medical background, they go out and they start taking this thing that they've seen advertised somewhere. You as a family physician, you know that that can be disastrous, can't it?
It can be. There's a lot of drug interactions out there. Even the over-the-counters do interact with prescribed medications. And some of these prescribed medications patients may take are pretty much, I would say, life-sustaining. They're very important medications, and if a patient had a problem with them, it could really hurt someone. So the best thing to do if you have an over-the-counter medication would be to bring it to your provider, or discuss that with Kyle at Gaddy's Pharmacy or their local pharmacist as well. I'm sure all of these people would be willing to kind of do a safety check for the patient. Yeah.
When people need to get access into this sort of arrangement that you're talking about, how do they generally do that? Is it the physician recommended?
Generally, because it's a subset or a small patient population right now, really this applies to high-mark Medicare patients. We're actively calling eligible patients. And in the future, if this program works out, we can always expand it and do other things. But I think right now it's mostly we're reaching out to patients. Yeah. So if a patient just receives a phone call, that's kind of what the program's about.
It is a benefit to all Medicare patients that qualify, though. So if patients aren't high mark or aren't aware of whether or not they would benefit from this service, they can always call us at Gaddy Pharmacy, and we'd be happy to review their medications, or their local pharmacists, whoever they use, and just say, do you offer medication reviews? A lot of pharmacies will do medication reviews, whether there's some kind of copay associated with that, or whether it is a benefit of their Medicare plan. So certainly if somebody wants their medications reviewed, certainly reach out to either Gaddy Pharmacy or another pharmacy that offers those services.
We're talking with Dr. Timothy Wong from the IRMC Physician Group, Kyle McCormick from Gaddy Pharmacy this morning about medical therapy management. Is this a model that is in place in other communities, elsewhere within the medical community, that you are able to study and say, that's something we need to bring here?
Actually, I think we're a unique model right now. We're, I think, as far as I know, the only kind of physician group that works with Highmark, that works with a local pharmacy. Now, the whole medical therapy management model it's a national Medicare benefit. So that model there's so many variations of that model. Sure. But with Highmark, I think we're the only kind of unique group. And I think having Kyle and Gaddy's Pharmacy give an extra kind of check for patients in person and even over the phone does provide special care. And that's why we're actually reaching out to we reached out to Gaddy's Pharmacy for extra help.
Yeah. I have a very limited knowledge of this, so I'm just going to throw the situation out there. You can correct the scenario that I'm going to throw at you in whatever way you want. But as an example, somebody's taking medication for lipids, and they're trying to reduce their lipid count. They read on the internet that when you take this medication, here's something else that you can take that's also going to help to reduce it. That can react with that medication, can it? An herb they're taking, a vitamin supplement that they're taking, all of that can react together and really be harmful.
Oh, yes. A good example is a common over-the-counter called St. John's wort. It's used a lot for depression, but the problem is it does have a lot of drug interactions. It actually changes how the liver metabolizes drugs, and the liver is so responsible for metabolizing and changing the drug that it has so many potential drug interactions.
Yeah.
But in general, I would say in this particular case, cholesterol medication really is the best, and over-the-counters don't really help cholesterol, at least in this case.
Yeah, but we have this big internet here, and there's so many websites that say that they want to help me. You know how people do. And you know what the results can be, the consequences of it all. Kyle, the program working well, I would assume, for Gaddy Pharmacy and for the IRMC Physician Group.
Yeah, we've had a lot of good feedback from the patients that we've talked to. Like has been mentioned before, a lot of this has been going on, but it's been done out of a call center, whether it's in Pennsylvania or somewhere outside of Pennsylvania. Where they're calling patients, cold calling patients, and trying to do these services where they just don't know the doctors in the area. They don't have access to the medication list that the patient's supposed to be taking. So without that, it's just not as personal of a service. So a lot of the patients we've been talking to said really got a lot more out of this than in past years when I've done it. So that's been good from a cost savings perspective. That's another great benefit of this service is identifying whether it's a brand name medication that there might be a generic for that they're just not aware of, and making that recommendation then to the physician. So just different options for cost savings as well. So overall, it's been a good service.
Terrific. All right. Folks want to know more about it. What do they need to do?
They can call our IPG call center.
That's the thing to do.
Yep.
There you go. Gentlemen, thank you so much for coming in.
Thank you.
We appreciate it very, very much. It is Indiana in the Morning, presented by First Commonwealth Bank here in the voice of Indiana County, WCCS, AM 1160 and 101.1 FM.